I got a phone call from an incarcerated individual's mother, and he was terminally ill. She wanted me to assure her that he wouldn't die alone in prison. And that really hit me as a nurse and a mother myself. I couldn't give her that reassurance that he wouldn't die alone. So that was really the start of this program. I wanted to be able to do death better. I wanted to be able to tell family members that we are going to sit with your loved one. Someone is going to be there because their life matters.
The Hospice Volunteer Program was designed with a holistic approach to end-of-life care, addressing the physical, emotional, and spiritual needs of incarcerated individuals who have a terminal diagnosis. Hospice volunteers are selected from the general population of incarcerated individuals who meet the program's criteria. The program is a collaboration between healthcare professionals, hospice volunteers, and correctional staff to deliver a compassionate end-of-life care that aligns with Transform Nebraska. The Nebraska Department of Correctional Services integrated framework that prioritizes the holistic development and well-being of incarcerated individuals. The Hospice Volunteer Program was launched at the Reception and Treatment Center, located in Lincoln, Nebraska, as it is the center of excellence for healthcare services at NDCS. RTC is equipped with a skilled nursing facility, including rooms designated for hospice care.
I had the privilege of being CNA in this facility for almost 12 years now. Going back about 6 or 7 years ago, a friend of mine was dying. And there's really nothing that I could do for him in the moment. I was saying to myself that no man should have to die alone, regardless of what they're in here for. Here I am, a lifer, doing something of this great magnitude and privilege, because I've taken away so much from people, and I believe this is an opportunity for me to give back. I can't help but think about that it's going to be me one day. And so what would I want? So that's the level of companionship and empathy that I try to provide for every person down there.
The first cohort of individuals completed a comprehensive 10-week training program delivered by healthcare professionals, covering various aspects of hospice care: introduction to hospice care in a prison setting, communication skills with patients, families, and healthcare professionals, providing emotional support in dealing with grief, understanding and maintaining boundaries and confidentiality, end-of-life care principles and pain management, self-care and stress management for volunteers. Individuals typically spend a couple hours each day volunteering for this program, allowing them to also maintain employment within the facility and to participate in programming.
Well, I've been a CNA medical porter since the inception of the program in 2011. Most of us that have been incarcerated for any length of time have seen our loved ones pass away, and we can't be there for them. This gives us an opportunity to pass on to somebody else the ability to have some compassion, somebody with some compassion with them, and we can have limited communication with the family members so they know that we're looking out for their best interests. We have each other. We are our family here.
The hospice volunteers extend their support throughout the entire end-of-life journey, forming connections with patients well before the final stages of hospice care. Hospice volunteers provide companionship and emotional support, assist with daily activities such as mobility, meals, reading and writing letters, and stand vigil with terminally ill patients to ensure that they are not alone in their final moments.
I did a lot of research on prison hospice programs and what that means for reentry, what it means for recidivism, what it means for reconciliation for families. Not only are there positive outcome measures for the terminally ill patient, but there are outcomes for the volunteers themselves. This program affects them just as deeply as it does the families and the patients that are dying within these walls.
They provide much more than companionship. They become trusted confidants, guiding patients through deeply personal end-of-life discussions and helping to clarify and fulfill their final wishes.
For individuals that we have currently there, we've been able to bring in family members that individual hasn't seen in a really long time. And so just kind of based on the end of life process and time constraints that we may have, we're able to make exceptions for those individuals to be able to have visitors come in, not only in our regular visiting area of the facility, but to actually bring them down to their hospice rooms, meet with them at bedside, have those difficult conversations in private, say final goodbyes or anything that they want to say. And it's been really, really awesome to be able to make those accommodations work for the people that really need it.
When I first found out that they were having a hospice program, I immediately jumped all over because of a personal issue. And it's just comforting to know that we can be there for them and help ease some worries for their family and everything while they're thinking about that stuff. It's just an all-out good program.
This level of involvement has a profound impact not only on the patients, but also on the hospice volunteers themselves. For many, this is an opportunity to develop valuable skills such as empathy, communication, and emotional resilience, along with contributing to a meaningful mission.
I started this by accident, and they allowed me to go visit with guys in the back that was already in hospice care, and we had an opportunity to sit and talk and just laugh and joke with them and listen to their stories. It gave me an opportunity to look at myself and see if I had my stuff together, which I really realized I didn't, because I wasn't prepared for the things that came along with death. And the information that this program has provided me with, is very important for me now, to take care of my own stuff and make sure that when my time do come, everything's in order, paperwork-wise, family-wise, and just knowing the things I know now is a whole different ballgame. Getting up every day, going and do these things is rewarding as an individual. It's not about my story, it's about these guys that we sit with. There are people in here like myself and other people that you'll meet along the way that care. And it's our responsibility to take care of each other.
The culture change within the facility is really what has given me goosebumps. We have been able to change the hearts of incarcerated individuals, but staff members, that's really where we're making a difference. We're changing the culture here at the Reception and Treatment Center, and we're starting to change the culture out into the community, developing partnerships with hospice programs in the community and long-term care facilities. And we are able to ensure that our focus is compassion and care. And with this program, we are doing death better in Nebraska prisons.
There is some redemption inside these walls also. I hope my past is not going to be my destiny, my worst day of a lot of people's lives. I don't want that to ever define my existence going here forward. We need each other in here, and we are our family. And so we stand by our family and support each other.